Right. I'm Rainer Hein. I'm a consultant psychiatrist and professor of psychiatry. I want to report about some papers we have published in Global Psychiatry. This is a paper from Castaldelli-Maia from Brazil, and it's about the main gaps for randomized controlled trials in psychiatry. So the study, it looks at different publications. It just looks at randomized clinical trials and sees how often they are more or less published over the recent years. It goes in 5 years intervals and other intervals. It goes to the whole of the difference of ICD-10. So let's say in that way, the 10th revision of the International Psychiatric Statistic Classification of Diseases and Related Health Problems, so ICD-10 was used. And there were different diseases which they looked at. And so this was, if you know ICD-10, it's the International Classification of Diseases, and there are 11 groups: organic disorders, mental disorders, which is F00, so Alzheimer's disease would be F00.0. Then you have drug abuses, so it's F10 and following, F20 and the following is schizophrenia, F30 following is affective disorder, then F40 plus is neurotic, stress-related and somatoform disorders, and F50 is behavioral syndromes with physiological disturbances and physical factors. Then comes personality disorders and mental retardation. And then a remaining group of mixed disorders or psychological development. So these the search criteria was a bit more detailed in looking at individual diseases. They were all RCTs, so randomized clinical trials. So lots of different diseases, and in total 123 diseases were looked at. And what they looked at over the last 20 years, 5 years periods or 2 years periods, and then these were combined and then assessed. So this is a table which gives the percentages and the statistics about that. To make it a bit easier, I'd like to focus on this study, this figure. This shows, the number of all mental disorders, and if you divide it by 20, all published randomized clinical trials. The interesting part is, so this goes from 1999 to 2018, so 20 years. And what's interesting is over the last years, so from 2016, then the number of studies goes down. So that's a bit of an unusual finding, but it's reproduced. So the number of RCTs goes down. This could be related to the fact that the pharma doesn't get enough new studies, or try other studies or focus on other issues. But it seems to be that the number of studies doesn't continuously increase as it has done since the 90s. So then we look at the different studies, and what you can see here is that studies which related, this is a total number of studies, but what we found is that the studies like F20, dementia, and organic disorders have been increasing. So that's a little bit in the middle. So the total number of studies again goes down a bit. That's a logarithmic scale. And maybe, which is a little bit more instructive, is the fact what is studied over the years. And over the last 20 years, when you can see depression has lots of studies, which possibly is related to big pharma, schizophrenia, an awful lot of studies, dementia, insomnia, all medication-related, bipolar disorder, eating disorders, generalized anxiety disorders. When you compare this, alcohol abuse disorders, relatively limited compared to depression, PTSD, drug abuse, plenty of studies, but not as much as depression and schizophrenia. Depression is a complete winner in this. OCD quite frequent, and middle to low number of studies. Personality disorders are absolutely frequent in the clinical services, have a limited amount of studies. When you look at this, for 20 years, 100 studies, which are RCTs, is not that much. Postpartum depression, but then when you see something which as sexual dysfunction, tobacco abuse disorders, phobias, schizoaffective disorder, possibly slightly undervalued. If you look at over the last years, so it seems depression, so that's in the last 2 years, depression is still the leading disease assessed by RCTs. Dementia is still important, and delirium has seen a bit of an interest in RCT. But other studies which possibly have a quite high prevalence, like sleep disorders, are much less researched. So what you see is that it seems a little bit like that. Fashion and interest of pharma have a bigger influence into the publication of studies than the clinical relevance or the prevalence of the disorders. So in this respect, it's a bit sad that not all disorders which are prevalent and are completely relevant have the same attention like depression. When you look at depression on its own has nearly more research RCT studies altogether than the rest of all the studies. And another third is done by schizophrenia. Schizophrenia is not even the most prevalent of mental health problems, but has an awful lot of scientific interest. But other studies, when you compare to that, it's much less. So I think outstanding is depression is the big winner, possibly more than the rest of the other studies together. And this is a bit questionable whether this is justified. I would say anxiety disorders are sometimes as frequent as depression, but they're not really researched as well. If you want to read this paper, please go to www.globalpsychiatry.co.uk. If you're interested in these short snippets of information and which give you quick insight in the studies, please check our YouTube channel, Global Psychiatry Archives. And if you want more, please don't forget to subscribe. We also show other scientific work and sometimes practical clinical information. So you're welcome to subscribe and look at our channel. Thanks for your interest and have a nice evening.